Welcome to my YouTube channel and our ongoing discussions about psychiatric disorders. Today's video we're going to talk about Autism Spectrum Disorder. Now, this is a very broad term. It affects a lot of children, adolescents, and even adults. And it's confusing as to what it is because in the old days it was split into autism disorder and Asperger's. And there's all sorts of psychological theories as to why, cold mothers, refrigerator mothers they used to call them, and all of those have been debunked. This is essentially regarded now as what we call a neurodevelopmental disorder. In fact, the word autism actually is a very old word, and it comes from a guy called Eugene Bloiler, who first described schizophrenia. And autism basically means in your own world. You're just disconnected, doing your own thing. And anybody who has a family member who's got autism or treated someone who's got autism very much knows how they come across in the clinic, at home, with others. And they do come across as living in their own world, kind of marching to their own drum. And that's pretty much how they are. They're kind of disconnected. And that's because there are obvious social skills and neurological deficits which are very pervasive. They're very obvious and they're very broad. So for example, they won't be able to read social cues. They will look at someone's face and think it means this rather than that. They really won't have that ability to read social cues and then modify their own behavior in response to it if they're acting socially inappropriate, for example. And that's because it's been shown that the wiring and the receptors in those areas of the brain is deficient. The circuitry, as it were, is deficient. And it goes with a gamut of different things. The DSM goes into the list, but essentially you've got social skills deficits. You've got a lot of repetitive behaviors, head banging, rocking, a lot of kind of OCD, what we call perseverative, doing things past the point of relevance. So asking the same question 75 times, rocking and banging their head, or doing that to soothe themselves. I've seen patients with schizophrenia who have that. So again, it's kind of related on some level with schizophrenia, although it's like you could argue a distant cousin because it doesn't have psychotic aspects, delusions and hallucinations like schizophrenia does, but it can share some of the, very much impaired social functioning, their ability to hold down a job, their ability to socialize, make friends, network. Because of their odd behaviors, they're not really going to connect with people. Other things they can have is unusual sensitivity for sounds, colors, tastes, smells. They'll like the sound of something, the taste of something. They'll keep on kind of like touching something in a certain way or certain sensation. Or sometimes they can be very hyper aroused by particular kind of music or a jarring sound. I don't know if anyone remembers Rain Man, the movie in the 1980s with Tom Cruise and Dustin Hoffman, when I think the fire alarm went off and Rain Man was the autistic brother, older brother actually, who was responding to that, and he was like having what we call a catastrophic reaction. He was freaking out to that. That's because, again, they don't have the filter, as it were, to filter out what the salience of what one sound is versus another, and they'll get overwhelmed very easily. It oftentimes can go with intellectual disability, formerly known as mental retardation, but we now call it intellectual disability, whereby you have obvious cognitive deficits. You're emotionally immature, you're mentally immature, on a cognitive level, you can't think or read or talk like an adult, and you'll be talking very much younger than your stated age, or you'll be slower in your milestones, you'll be clumsy, you'll be falling over, you won't be able to stand up at the same time as your peers, etc. And so these are very much what we call motoric deficits that are very intrinsic to autism spectrum disorder, and they can be also part of an intellectual disability. Now, not everybody with autism disorder has an intellectual disability. Some of them have the opposite. They may have superlative skills. You remember Rain Man when he was actually good with counting cards, etc. Well, those are the classic Asperger's syndrome end of the spectrum. And they have very finely tuned, very exacting mathematical or certain kind of unique abilities and proficiencies. But in other areas, they can be totally useless. I mean, it's like such an imbalance of the range of activities and functioning, that you are essentially dealing with a human being who just can't quite navigate their way successfully in the world. So very much their ability to manage day-to-day life is very limited. They may get very anxious easily. They may have obsessions and compulsions. They can get depressed. They can end up getting violent on occasions. Not everyone, not all the time. And I hesitate to say that word autism is a loaded word, but I want to emphasize again, just like I have in this video for things like schizophrenia, that it's a huge umbrella term. And within that, I have seen many people who have minor deficits in certain areas. are able to relate on certain areas, who are holding down a job, but they may need help with some anxiety or some obsessions. And so not everybody presents the same. I've seen people at the other end of the extreme who are extremely violent, and you cannot communicate with them on an abstract level at all. So one wants to be not generalizing about this, but in the DSM-5 specifically, because of funding issues for autism versus non-autism, it's complicated. But essentially, they merged into what we call an autism spectrum disorder. They lumped things like Asperger's and traditional autism together. And I think that's fine. I just think it's important in the treatment of it not to generalize about their abilities and to really ask specific questions in these areas I talked about. In treatment, really, again, it's a biopsychosocial model. In other words, you want to combine various approaches. From my perspective as a physician, I will oftentimes use medications such as SSRIs. Why? Because they're good for obsessions. They're excellent for obsessions. There's a particular part of the orbitofrontal cortex I talked about in my previous videos, and so that can really be very helpful for the OCD aspect of their autism spectrum disorder. Sometimes they'll have these lists of all these diagnoses, but they may be all attributable to autism alone. And so we don't want to get confused with the diagnostic picture when we see a patient who's been labeled with autism and this and that. That said, there are some comorbidities that are very obvious with autism. ADHD, for example. You would expect that the prefrontal cortex functioning would be affected in autism spectrum disorder. It is, after all, a neurodevelopmental disorder. It starts from birth. The deficits start to become obvious as the patient grows, through their childhood years. And so you wouldn't be surprised if you found ADHD as a comorbidity, and they may benefit from stimulants. They may not. That's the judgment call of the doctor, because the anxiety versus ADHD, you want to make sure that things are not getting worse with a stimulant, but if their thinking is helped and their anxiety is adequately managed, you may want to give them a stimulant, to boost their prefrontal cortex functioning. Just like other human beings, they will become anxious, they'll become depressed, they may not know how to handle certain things, they've got to learn life and coping skills. And so that's part of an ongoing program. Specific to autism spectrum disorder is learning social skills training. How to read social cues, how to express yourself, how to talk about feelings, how to maybe articulate feelings. Because oftentimes they don't have the language for it. It's very intellectualized, very almost robotic, mathematical sometimes, a little bit cold. And learning how to express oneself, and get one's needs met is very important. And that's a very long-term kind of life skill that they're taught and is going to be part of their rehabilitation for the rest of their lives. So that is basically autism spectrum disorder in a nutshell. I welcome your questions on this. I know that many parents are dealing with the manifestations of their child's autism spectrum disorder. It has been stigmatized to some extent, but I think it's come out of the closet, as it were, in that people are much more respectful of its manifestations and the kind of overall comprehensive treatment plan it requires, more so than, say, arguably schizophrenia. And that's because of the advocacy of many of the parents who've had to deal with this very disabling disorder in their children. And, I respect that, and I welcome any further comments or suggestions on how I can educate you all on this very disabling and important disorder. Once again, I want to thank you for watching this channel. Thank you very much. Have a great day.